Low back pain, hip pain, sciatica. So frustrating to have and can be very annoying. I'm Dr. Brian with Healthy Compassion, and today I'm going to share with you things you can do at home that are effective and simple. And these are some of the strategies that some of the top doctors around the world have helped create that we're getting great results with. Now, for those of you who are having these issues, it could be annoying, it could be frustrating. Some people feel like they're 20 years older than what they actually are. And if this is what you're going through, I'm really sorry, but there are things you can do that will help you dramatically change the way you feel. And that's the whole purpose of these videos. So many of you have had these issues, like I said, for many years. Some of you, it's excruciating pain. Some of you, you're kind of getting by. Others of you have explained to me it's hard to sit for a long period of time. You're always sore when you get out of bed. You can't play with your kids or your grandkids. And that's just frustrating to have that in your life. So I'm going to go over some things you can do now that will give you some relief. One of our patients from one of our doctors, we have many doctors around the world that we work with, her name is Karen, and she was suffering with back pain and sciatica for over 27 years. She's been to other chiropractors, other physios, massage therapy, tried medication, and she would get better, but it was never completely fixed, or she never felt 100%. So she implemented some of the strategies that I'm going to show a couple of those with you today, and within 3 weeks her pain was gone completely. Isn't that amazing? So we have countless stories like that from all over the world. I'm going to share a couple of these with you now, the strategies that we do. Okay, so I'm kneeling down right now. I'm going to back up so you can see me. So let's go back up here. So make sure I don't step on anything. So the two things you have to understand something is that the pelvis and the lower back muscles are kind of attached. So the hip flexors attach to your lower back and your pelvis, and so do the buttock muscles. Okay, so we're going to loosen those areas up, and I'm explaining to you exactly what we're going to do. The first one is called a psoas stretch. Oh, before I forget, if you want to know the top chiropractor in your area that everyone's raving about for back pain, hip pain, and sciatica, please visit mytopchiro.com. It'll take you to our website, healthycompassion.com, and there'll be a drop-down list of the towns close to you. Just click on the town that's close to you, and it'll take you to that chiropractor information so you can learn more about what's going on with that chiropractor. Okay, let's get to it. So first thing is good old psoas muscle, okay? Psoas is spelled with a P, by the way. So the psoas muscle, what you're going to do is you're going to put your feet facing this way, so they're not like this, okay? So we're not like this. They're straight, facing this way. They're about that far apart, and you're just going to keep your heels on the ground, and you're going to feel a stretch right in the front. You might also feel a stretch in your quad. That's okay. If you're not feeling it up here, you pelvic tilt. So you put more pressure, and you'll feel it here in the psoas muscle. Do the stretch 3 times a day and hold for 30 seconds. Now, if you want to hold longer later on, you can, but in the beginning, hold for 30 seconds. Okay? So heels on the ground, feet pointed this way, about that far apart. Don't try to really go too far, just gentle. And you'll find out during those 30 seconds, after maybe about 12 seconds, you're like, I don't feel it as much. Then you go a little bit further. Okay? Hold the stretch 3 times a day, hold for 30 seconds, and obviously do the other side, okay? That's number one. That's a big one. That alone will change many things from a standpoint of how you feel. The second one is we're going to stretch something called the piriformis muscle and the gluteus medius. Now what you want to do is you want to use a wall. And by the way, all this stuff I like to teach patients from all of our doctors, because a lot of people have jobs. They can't just lie down and do stretches during work if they want to keep that job. So we would do things that they can do anywhere. So this one, you're going to lean against the wall, okay? You're going to bring your leg up and your knee over, kind of pointing towards your shoulder like this, okay? Hold 10 seconds, and then as you're balancing yourself, you're going to push this knee like that. Take it through a range of motion, and then you're going to come back out, and now you can see I can go further doing this, okay? So it's hold for 10, push for 5, hold for 10, push for 5, get to the spot, hold for 10, push, and then, by the way, when you push, you take it from here, and you bring it all the way out, okay? Hold for 10, and then push for 5. And the same thing on this side. These two exercises are so crucial, and again, we've seen just thousands of patients around the world get great results with the hip pain, the back pain, and sciatica, implementing these strategies, including the 2 that I just showed you. But again, if you want to know who the top chiropractor in your area is that everyone's raving about here, let me come in a little bit closer. If you want to know who that is, go to mytopchiro.com. It'll take you to our website, healthycompassion.com. There'll be a drop-down list. of the towns close to you. Click on the town that is convenient for you, and you can learn more about that chiropractor. So I hope this helps. I hope you guys learned something. If you find this valuable, please share this with other people, because a lot of people don't know about these simple strategies that they can do at home. So I want to thank you so much. Have a great day.